Once again, you are welcome to Angel Health Academy. Subject, Community Health Nursing. Topic for the day is Referral System. First is definition. Referral system refers to the system in which the patient is sent from the health center with fewer amenities to the health institution or treatment center which has more resources, facilities and amenities. That means, referral system is a system where a patient is transferred from one institution where less facilities are available to other institution or treatment center where more facilities such as more resources, more facilities and more basic amenities are available. So in another definition, referral system is defined as a system of transferring cases, that patients which are beyond the technical competency of one infrastructure to a higher level infrastructure or institution having more technical competency and all other resources to provide desired health services. Next is concept of an ideal referral system. There are mainly three concepts. First concept is referral system is a process of directing a client to another source of service. So shifting or transferring a patient from one center to another source of service. The second concept is referral system is one of the key function of a community health nurse. The third concept is referral system is an organizational structure for coordinating, linking, that is connecting and transferring the responsibility of the patient care from one center to other center. Let us explain in detail about concept of an ideal referral system. So the first concept is referral is a process of directing a client to another source of services or another source of assistance or another source of information. Second concept is referrals is the one of the key functions of a community health nurse. It is an important functions of the community health nurse. Third is referral system is an organization structure for coordinating, linking and transferring the responsibility of care of a patient from one level to another level, that is from primary level to secondary level or secondary to tertiary level or generalist to specialist level or one specialist to another specialist level or one hospital to another hospital level. So these are the three concepts of ideal referral system. Next is purposes of referral system. There are mainly three purposes. First is to provide need-based comprehensive care to the patients. Second purpose of referral system is to help people avail specialized services. Then third purpose is to streamline the appropriate use of PHC infrastructure and specialized services. So let us explain in detail about the purposes. The first purpose is to provide need-based comprehensive health care to the patient efficiently and effectively within the technical competencies and resources available at each level of primary health care infrastructure. Second is to help the people to avail or get the specialized services that is available in higher level institution, that is secondary level institutions which are beyond their reach. Actually, they may not be able to go there, but we refer the people from primary center to secondary and secondary to tertiary to get the specialized services. The third purpose is to streamline the appropriate use of primary health infrastructure and other specialized services in order to prevent the overloading of the specialized institution by direct uses by the patients. So those who are required only to be transferred to the specialty or specialized services or for secondary and tertiary services. These are the three purposes of referral system. Next is types or classification of referral system. It can be classified into traditional, modern and others. So there are three main classification: traditional referral system, modern referral system and others. Traditional referral system includes external referral system and internal referral system. External referral system also includes vertical referral system and horizontal referral system. Then modern referral system, I have made a small mnemonic, that is ICCSS. Then others includes intradisciplinary referral system and interdisciplinary referral system. Intradisciplinary and interdisciplinary referral system. Let us explain in detail about the types or classification of referral system. First is traditional classification of referral system. It includes external and internal. External includes first is vertical. In vertical referral system, patients are referred from lower level to higher level facility and even vice versa. According to the need of the patient, patient is referring from lower to higher level. That is from primary to secondary, secondary to tertiary. Then second is horizontal level. Here patient is referred from one facility to other facility and vice versa. From one facility to other facility. So there are different specialized services available and patient is getting or availing their services from one facility to other facility. That is horizontal. Then internal classification. Here patient is referred usually within the health institution or health center or hospital. So patient referral usually within the health facility from one health personnel to another health personnel. From one specialist to another specialist in the same institution or health center or hospital. That is internal. The second type of classification is modern classification. There are 5 classifications in modern classification. First is interval referral system. Second is collateral referral system. Third is cross referral. Fourth is split referral. And the last one is self referral. Patient individually get referred. That is self referral. So the mnemonic you can use here X. So ICCSS. Double C and double S. First is interval referral. Here the patient is referring from one center to another center for the complete care and it is for the short period or limited period. Second classification is collateral referral. The referring MD retains all the responsibility, overall responsibility of the patient care, but refers patient to care for some specific problems. The main MD or physician of the particular patient is having overall responsibility of the total care of the particular patient, but some specific problem he has to transfer to get the specific services. For that purpose, the patient is sending to the referral. That is collateral referral. So here the referring MD retains the overall responsibility of the patient. Next is cross referral. Here patient is referred to another MD. So the responsibility is shifted from the particular MD to next MD. So once accepted, the referring MD has no more responsibility in patient care. Fourth one is split referral. Here the responsibility of the total patient care or overall responsibility of the patient care is shared between the 2 or more MDs or physicians. So in this referral, the responsibility is divided between 2 or more MDs. The last one is self-referral. That is patient himself make a referral to get a better services or facilities for the patient care. The next classification is other types of referral system. There are 2 types, that is intradisciplinary referral system and interdisciplinary referral system. First one is intradisciplinary referral system. So here when a patient cannot be treated or neither properly diagnosed or not satisfied with a particular treatment or therapy, then the patient can be referred to another therapy of same discipline according to his need. Example is allopathic treatment to another allopathic treatment where more facilities and resources are available. That is intradisciplinary referral system. Second is interdisciplinary referral system. Here it is patient is shifting or transferring in referral, that is from one discipline to other discipline. That is the patient shift often from one system to another system. That is from allopathic system to another indigenous system of medicines or in Ayush to get further and better treatment. Next is importance of referral system. The first importance of referral system is used to provide diagnosis services. For the advanced diagnosis services, the patient can be referred. Where there is no facility, he can be referred to get a advanced or for the differential diagnosis services. Next, referral system, of course, in referral system, patient getting specialist services. So, providing specialist services. Third importance is propagating the purpose of referral system among health workers. So referral system is very mandatory sometimes and it is very crucial in some period. So propagating the purpose of referral system among the health workers, making the health workers to understand the importance of referral system when it is necessary. Then fourth one is preventing further complications and providing appropriate and adequate treatment for the particular patient. Then fifth one is teaching nursing personnel for reviewing and sending patients for referrals. So Here, nursing personnel would understand when the patient has to be referred. That is for reviewing and sending the patient for the referrals. The last one is safe referral transport. Another importance of referral system is now the recent concept is referral transport, providing transportation for during the referral period. So safe referral transport with all the facilities according to the condition of the patient. So these are the 6 importance of referral system. Next is principles of an ideal referral system. So the 3 area we can make for the principles that referral system should be merit in referral process. Second is it should be practical and it should be individualized care. It will be varies from patient to patient, the referral services. So these are the 3 areas of ideal referral system. First is merit in referral process means there would be a need of objectives. The first principle, there should be clear-cut needed objectives, or it need objectives to refer a person from one institution to another institution. Second is referral system should be impractical. So no waste of time and no waste of money. No wastage of time and money in case to any referrals required. Immediately it has to be done without further expenditure. The last area is individualized care. So that means meet the need of one patient. That is important. A particular patient has to get an adequate treatment. So meet the need of one patient. That is, it is individualized care. So principles of an ideal referral system includes a merit in referral process, practical, and it should be individualized care. Next is selection of patients for referrals. Selection criteria. For this purpose, patient can be classified into 3. First is first group or final patients. Second group or serious patients. And third is third group or general patients. So patient can be classified into 3 groups. First, second and third. That is final, serious and general patients for the purpose of making referrals. The first group or final patients. These are the patients, they cannot survive even we send for them referral for the best treatment. So the patient cannot survive despite the best treatment made available to them. That means sending them for the referral is the waste of the time and waste of the money. Instead of that, we have to give appropriate treatment or better treatment at the same institution or center itself. Then we have to make the relatives to understand that owing to their fatal conditions and it will not be beneficial to send those patients to the referrals. The second group includes serious patients. Second groups are serious patients. Their condition are very serious, but immediate treatment referrals can save their lives. Provided before sending those referrals or those patients, the attempt should be made to reduce the seriousness of their condition. Then only after that we have to or we should send them for the referrals. So the second group or serious patient includes those patients with the serious complications and serious symptoms and they need immediate treatment or referrals can save their lives. Only the things before sending them for the referral, we have to reduce their seriousness of the condition or symptoms. Then only we have to send them for the referral. The last group is third group or general patients. The patients comes under general patients or third group. They may have serious diseases, but they are found to be normal. Such patients can immediately send for the referrals. The patients includes in general patients or third group, maybe after the surgery or the patient need a further diagnosis or the diagnosis not possible at the particular institution and they may need some new special technique of investigations or therapy, or patient has to be sent for the that multi-speciality or super speciality hospital for the further consultation. Next is levels of referral system. In ideal setup, primary healthcare activities or primary healthcare services in the community are supported by different levels. These are called as levels of health services or levels of referral system. In our system, the referral services are provided at 3 levels mainly. First one is at primary level, second one is at secondary level, and third one is at tertiary level. So there are 3 levels of referral system: primary, secondary and tertiary. Let us discuss in detail with the flow chart. So the flow chart of referral services, starting with the primary level, then secondary level, then tertiary level. Primary level is actually referral services starting at village level. So at village level, it is started from ANMs, ASHA workers, traditional birth attendant, Anganwadi worker, village health guide, that is a village health post. So they are the community health worker or village health post. Starting from those level, then they refer the patient to sub-center, then from sub-center to primary health center, and from primary health center to community health center. These are the government health centers, and community health center is the referral hospital with 30 beds. So at village level, there would be a primary level services for the patient. Next level is the secondary level, that is at taluk level. So from community health center, the patient will be referred to the next level for the secondary level services at taluk level. The services is provided by taluka headquarters hospital or subdivisional hospitals, which includes government hospitals or private hospitals. They provide the secondary level services to the patients. Then from the secondary level, patient will be referred to tertiary level, that is at district level, including state. The institutions includes a district headquarters hospital or district hospital. Then other government general or regional hospital, that is state level hospitals, regional hospitals, and specialty hospitals. So various specialty hospitals, even from medical college hospitals. Moreover, the patient will get the tertiary level services from the super specialty hospital, both in government and private hospitals. So these are the flow chart for the referral services, starting with the primary level, secondary level, and tertiary level. So at primary level of care, patient will be available both in urban and rural areas. This is the actual referral site for the village health worker or community health worker and other basic health units like a sub-center, primary health center, and community health center. Then usually it is the first level contact or first contact level between the community and the other health facility or health personnel. And here patient will be available the treatment for the or services for the common and minor ailments that require the simple, uncomplicated interventions could be done at primary level care. That is the first level of referral system. The second level is secondary level of care. It is the referral site for the primary care facilities. Here patient will be avail primary care facilities. Usually it is rendered by the specialists. And the secondary level care is given for the serious conditions. Patient with the serious condition, they might be needed technical interventions and inpatient services, inpatient care services, which are not actually available at PHC level and CHC level or rural hospital level. Third is the tertiary level of care. It is a referral site for the secondary care facilities. Patient avail the secondary care facilities. And tertiary level care is provided for complicated, uncommon and serious diseases. Patient with the serious diseases, those require highly specialized services and high technology interventions for their ailments or problems. This is about the three levels of referral system. So in short, levels of referral system starting from community level, at community level, then health centers, especially sub-center and primary health center, then dispensaries available in the community, then rural hospital or community health center hospital. The next level is taluka headquarters hospital, that is secondary care level or subdivisional hospital. Then district hospital, district headquarters hospital, regional hospital or a state level hospital provide the tertiary level care at district level. Then even it will be given by medical colleges, specialty hospitals, even national level referral hospitals. So this is the levels of referral system. In other side, levels of referral system starting from family physician to PHC, primary health center specialist. So health services is shifted from family physician to primary health center specialist. Then the patient may get the services from one specialist to another specialist. Then sometimes from junior specialist to senior specialist in the secondary level. And at last in the tertiary level, they may avail the services from general hospital to specialty hospital, especially medical colleges, other super specialty or specialty hospitals. This is about levels of referral system. Next is when to refer a patient. The four conditions to refer a patient for the referral system. First is when the family physician need specified investigation or advice for his patient. So when the family physician require or need some specific investigation for his patient or specific advice about the treatment for his patient, the patient can be referred. Second condition is when the family physician dissatisfied with his patient's progress of the treatment. Then third condition, when the patient or family show doubts about the treatment aspects, or they may have a lack of confidence in the diagnosis and the treatment of the patient, they can transfer or they can think about the referral of their patients. Fourth condition is medical legal concerns. If there is any medical legal concerns, either by the physician or the patient or both, so they may legally, the patient may avail the services by transferring from one level to other level. That is medical legal concern by the physician, patient or both. So these are the four conditions where the patient require referrals. Next is need for urgent referrals. Some disease conditions patient may require urgently refer to another level. For example, hyperpyrexia, high fever not responding to the particular treatment, severe pain to any part of the body that is continuous for more than 3 days. Then stiff neck, stiff jaw with the arched back, even that is symptoms of the tetanus, and even patient with convulsions, more than one attack with fever or serious illness, or convulsion without any special cause. These are the cases patient need urgent referrals. Then hematemesis, hemoptysis, then pain abdomen, frequent vomiting, absence of bowel sounds, black colored stools, then any complication of deliveries, then patient in coma stage, severe diarrhea that is not responding to the ORS or other treatment, fluid management. Then in severe cyanosis, patient is having severe cyanosis, then retention of urine, that is more than 18 hours or 24 hours retention of urine. Then chest pain in heart patients, for chest pain, angina and etc. Then multiple trauma including fractures. So trauma including fractures, any poisonous conditions, and any other fatal or life-threatening conditions all require for need for urgent referrals. Next is factors affecting referrals. There are 7 factors which can affect the referral system. First is availability of the qualified consultants. So referral system can be, or referrals can be planned and implemented when qualified consultants are available. Then according to the specialty of the physicians. So referrals can be taken place according to the specialty of the physicians. So we need more physician with different specialties to make a referrals. Another factor affecting the referrals, that is length of the training period of the physicians. Other factor affecting to referrals are unexplained findings, unexplained or undiagnosed cases, uncertainty of diagnosis, not sure about the confirm about the diagnosis of the patient. These are the other factor affect the referrals. Then patient's characteristics that also influence the referrals. Then reimbursement plan. So patient may have a reimbursement plan, then patient can go for the higher level super specialty health services. So these are the 7 factors affecting to referrals. Next is benefits of referrals. It can be classified into or divided into for patient, for family physician, and for the consultant. So for the patient, the benefits of referrals or referral system is patient may get prompt diagnosis and management or treatment. Patient can save the money, time and effort. Then there will be a better prognosis or better outcome for the patient. In case of family physician, he can get an opportunity for learning and training of the patient treatment, his patient's treatment. Then gaining self-confidence in treatment of his client, gaining self-confidence. Then increase the communication between the healthcare staffs. So referral system indirectly increase the communication facility between the healthcare staffs. Then benefits for the consultant. Consultant also can improve the quality of his services for the patient management. Improve the quality of the patient's management or treatment. Then increase the communication between the healthcare staffs or healthcare team members. So these are the benefits of referrals or referral system. Next is steps of referral process. So there are 8 steps in referral process. First is starting with establish a good relationship with the patient. So maintaining a good relationship or rapport. Second is establish the need for a referral services. Then set the objectives for the referral services. Then explore the resources availability. Find out the resources available in primary level, secondary level and tertiary level. Then next is get the patient choice whether he is required to refer or not. So whether the patient use the referral system or not. Then 6th step is make pre-referral treatment. So whatever the condition, the patient has to be given pre-referral treatment. That is the 6th step. 7th step is facilitate and coordinate the referral system and referral process or referral services. Facilitate and coordinate the referral services. Last step is evaluate the referral system or referral services and follow up the referral services. So these are the 8 steps of referral process. Next is referral letters and forms. First is referral letter outline. Referral letter usually consists of patient details, age, sex, etc. Patient details. Then family physician details, to whom the patient has been taken care. Then reason for referral, why the patient is referring from one level to other level, reason. Then degree of urgency for the appointment of referral. Then clinical problems of the patient. The referral letter includes clinical problems and symptoms of the patients or conditions of the patients and important previous history of the patient. Patient history, that is past history. Then findings on the physical examination. What are the findings on physical examination of this patient? Then findings on investigation. Already patient might have done some investigation, the findings of that investigation. Then medication and drug sensitivities. If there is any allergies for particular medications, particular drugs, etc. That is medication and drug sensitivities. Then last, information regarding expected outcomes and desirable follow-up services. Expected outcome and desirable follow-up services. So these are the outline of a referral letter. Next is about referral forms. This is a sample of referral form, which includes name of the health center or hospital, name of the referral unit, referral registration number. Actually, there would be a registration number for the patient during referrals, the name of the patient, father, husband's name, etc., age, sex, religion, occupation, present diagnosis of the client, case history in short. Then description of treatment already given to the patient, date of sending referral and cause of sending referral. What is the reason for sending referral? Then signature, name of the center or consultant and his designation. The document has to be enclosed, that is the enclosed papers, lab test reports and other investigation reports what have been already done for the patients. This all comes under enclosed papers. So this is the sample of the referral form. Then the replay form. The replay form of referral system includes additional finding which has been conducted in the referral center, that is the report of the additional findings. Then diagnostic work what has been done and its result. So diagnostic work up done with the result. Then final diagnosis, confirm diagnosis of the patient. Then the plan of management and treatment. All these 4 areas could include in the replay form. Additional findings, diagnostic work up done with the result, then final diagnosis of the client or patient and plan for the management or treatment. The important section of referral system is problems and suggestions of our referral system in India. First is problems of referral system. There are mainly 11 important problems in referral system in India. First is poor knowledge among the health personnel. Poor knowledge. Then second one is lack of coordination between the referral centers. Level of referral centers. Primary, secondary and tertiary referral centers. Then structural and clinical constraints, inadequacy of the referral centers, structural and clinical facilities and resources. Then fourth problem is not using the referral forms and replay forms. Then fifth problem is no involvement of the patient in the referral system. The patient has to be decided whether he need to go for further treatment or no. So that is no involvement of the patient in referral system. Then improper management of recording and reporting related to referrals. This is the another problems of referral system in India. Then seventh problem is delayed referrals and time lag. So sometimes patient cannot be identified immediately for the referrals. It may get delayed. So delayed referrals. And sometimes patient has to be stay for a long period, waiting time. That is a time lag. So time lag and delay in making referrals by the health personnel is another problem of referral system in India. Then of course we have a lack of resources, man, money, material resources in the referral centers, primary, secondary and tertiary levels. Ninth problem is inappropriate identification of the patient for the referrals. Inappropriate identification of the client or patients for the referral system. Then 10th problem is high cost for the referral services. High cost for the referral services. And the 11th problem is ineffective utilization of the available referral system, that is primary, secondary and tertiary. Ineffective utilization of the available referral system. So these are the 11 problems of referral system in India. Let us discuss the suggestions for improving the referral system in India. That is suggestions. There are 18 important suggestions to improve the referral system in India. First suggestion is strengthening the total referral system, primary level, secondary level and tertiary level. That is strengthening the referral system. Then second is systematically build the referral system in primary, secondary and tertiary level with all the facilities and resources. So systematically building the referral system. Then third one is strict criteria for making the referral system. There would be strict common rules and regulations or criteria for referral system. Fourth one is updating the knowledge of all health personnel in relation to referral services. Then structural and clinical strengthening of the referral centers. Structural and clinical strengthening of the referral centers. Then sixth one is ensuring the quality of health services in the referral centers in primary level, secondary level and tertiary level. Then seventh one is develop a common referral forms and reply forms that can be unified in everywhere. So develop a common forms which includes referral forms and replay forms. Then next one is well coordinated referral system. So there would be a good coordination between the primary, secondary and tertiary level referral system. That is well coordinated referral system. Ninth suggestion is proper recording and reporting in relation to referral system. So maintaining proper records and reports of referral system. The 10th suggestion is better housekeeping in the referral centers. Better housekeeping in the referral centers. The 11th one is involving the patients in his referral system. 12th suggestion is avoid delayed referrals. Make the referrals as early as possible. Avoid delay and time lag in referral services. Then 13th suggestion is identify the appropriate referral system that is needed for the patients. Identify appropriate referral system, the center where the resources is available. 14th suggestion is ensure the resources in the referral system in the primary level, secondary level and tertiary level. Institution should have adequate resources to meet the necessity of the patients. Then effective utilization of the available referral system. Effective utilization of the available referral system. Proper evaluation of the referral services of primary level, secondary level and tertiary level. Improve the efficiency of referral services. Improve the quality and efficiency of referral services. Then last one is 18th suggestion is be a referral resource personnel. All the health personnel including community health nurse should be a referral resource person. He has to give an adequate information to the patient in relation to referral services and referral system. So these are the 18 suggestions to improve the referral system in India. The last part of the session is responsibility of the community health nurse in referral system. There are 8 important responsibilities of the community health nurse in referral system. First one is update the knowledge of the community health nurse in relation to referral system. The availability of resources and services in the primary, secondary and tertiary level. So updating the knowledge related to referral system. Then second responsibility is careful selection of the patient for the primary, secondary and tertiary referrals. Careful selection of patients. The third responsibility is awareness of limitation and responsibility. So community health nurse has to aware her limitation and responsibilities in relation to or when she makes the referrals. Then fourth responsibility is in emergency save the life of the patient first, then only patient has to be sent to the referrals. So in emergency first we have to save the life of the patient, then only we have to plan for the referrals. Then fifth responsibility is all the entries related to referral system should be clear and correct. So all the recording and reports should be clear and correct. Then sixth responsibility is enclose all the necessary documents and records while sending the patient for referrals. Enclose all the necessary records and investigation reports etc. while sending the patient for referral. Then seventh responsibility is in emergency arrange all the life-saving equipments and medicines during the referral transport. So if there is an emergency or in emergency when the referral makes, it has to be arrange all the life-saving equipments and medicines for the safety of the patient. Then last responsibility is accompany if necessary. Escort the patient if necessary while making the referrals. So these are the 8 important responsibilities of the community health nurse while making referrals. So thanks for watching. Hope this video really benefits in your studies. If you feel it is worth and benefit, please like, share and subscribe my channel. Stay tuned with the Angel Health Academy till we meet with another and important educational video. Thank you.